Resources and Materials. We are joined today by Luisa Sueterna Castañeda. She joined us in December to discuss Text4baby. She is the Multicultural Outreach Manager for the Text4baby program at the National Healthy Mothers, Healthy Babies Coalition. She's going to follow up today with information on materials Healthy Baby provides. With materials Text4baby provides, as well as a background on Text4baby to refresh your memories. As you all know, Text4baby has partnered with the Office of Minority Health this Minority Health Month. They've contributed blogs. They've also helped support this month's theme, which is essentially 30 years of health equity. They've tweeted and announced things that they've done in support of health equity over the years, and we would ask that each PPE site do the same. Text4baby has also donated materials to PPE sites for Minority Health Month, and we will hand those out along with the mini awards this month. In addition to the mini, while we're mentioning the mini awards, again, the mini awards application deadline has been pushed back to April 20th. You may submit your applications before April 20th, but no checks will go out before the 20th. The earlier you submit your application, the quicker a check will be presented to your club. So the sooner you turn in your applications, the better. Without further ado, I'm going to hand things over to Luisa. And whenever you're ready, Luisa.
Wonderful. Well, good afternoon, everyone. Maybe good morning for some of you. My name is Luisa Sueterna, as Teddy mentioned, and I work with Text4baby. Some of you might have participated in a webinar that we had back in December. So I'm going to go ahead and start and give you an overview of Text4baby and provide input. There is a chat box on the screen. I'm sure you guys have done this before. You can type in your questions, and then those will be triaged by Teddy later on in the presentation. So really quickly, I wanted to give you an overview of Text4baby. For those of you who may not be familiar with it, what we do is we incorporate messages for moms who are pregnant or who just had their little one via text messages. The service is a free service, and the partners around the country who participate with us in getting the information out to moms, the content specifically, are organizations like CDC, the American Academy of Pediatrics, March of Dimes, the American College of Midwives, and OBGYNs. So there are a lot of public health initiatives and organizations who were really supporting us from day one in making sure that our information is reinforcing mom's intention to go to visits, to make sure that she gets her prenatal visits and immunizations as well, safe sleep, and just little things that sometimes we as women need to know and may not be aware of, despite sort of how well-versed we may be or educated. As you guys know, probably, within the African-American community, one of the big challenges really is about breastfeeding, and the fact that so many African-American women are not breastfeeding sufficiently, and that's one of our key components in Text4baby, really encouraging moms to breastfeed. Within the Latino community, one of the challenges there is more around nutrition, and for moms to really understand what is sort of the best nutrition that they need to acquire during especially pregnancy in the baby's first year. You come into a lot of issues with moms either being diabetic during pregnancy, and that can cause a lot of problems for both the baby and the mom, as well as babies being prone to be pre-diabetic because they're obese or close to being obese because of the way that they're fed within the Latino community. So those are some of the key topics that we understand and really try to resonate within our messages. We understand that there are other challenges that affect individual communities, but we have a gamut of messages, and so we really are in debt to all of the partners who support the service and who really help us take it one step above and beyond. So Text4baby, another cool thing about the service, and which I really love as a public health worker and professional is that Text4baby is a public-private entity. So I work for a nonprofit, the National Healthy Mothers, Healthy Babies Coalition, Vaxiva, who had been doing a lot of this work around mobile health and technology abroad, decided that they needed to do something here in the States. And they partner with Johnson & Johnson, the Wireless Foundation, and the Department of Health and Human Services to create this partnership. It's a one-of-a-kind, very unique partnership that really allows us to provide free information to moms, and it allows us to work with health entities, as I mentioned before, as well as federal and state and local government. But we also count with the support of organizations like Vaxiva, like Johnson & Johnson, and the Wireless Foundation to really make it all a reality. So it's a great way of showing how private and public entities can work together to lead the way in terms of health and how health is delivered. So give me a second. I'm trying to get to my next slide. The system's being a little slow. All right, perfect. So this is a schematic that shows you guys once again the different number of partners who are in the system, from hospitals to coalitions to to health systems, as well as media partners. We have a lot of ways to engage moms, but I wanted to talk really quickly about the actual content. So in order to enroll into Text4baby, any mom can do it, so you guys can talk to any of your girlfriends or folks in the community as you're out and doing your work during the month, and really encourage moms to sign up for this service by texting the word baby, or if they speak Spanish, they can do so by texting the word bebé to 511-411. Another beautiful piece of the project is that we are not intrusive in the sense that we don't ask a lot of questions of the moms. We simply ask for her due date if she's pregnant, or the baby's date of birth. And the reason why we ask that is because we want to know which specific messages we should be providing to her at that point in time, or to the dad. Sometimes we have dads who use the service, or family members, grandmothers, grandfathers. So I definitely encourage you to provide this information. And then the only other piece of information that we inquire about is really their zip code. And that just helps us sort of keep a level of data that's more, that's richer in a sense, and we can provide to our partners, and we can say, these are the number of moms in your community who have enrolled in the service. And so we're not intrusive because we don't ask about income. We don't ask some of the other data that other researchers will really love, and some of you who might be working in the health and medicine field may understand some, the reason why you might want some of this data, but we don't ask about race or gender or ethnicity, income, etc., which can have its policies, but it's great because moms don't feel like we're being too intrusive. So once a mom has enrolled and she's answered those 2 basic questions, she starts to get 3 messages a week until the baby turns 1. And here I just want to highlight that anyone can sign up for the messages anytime during their pregnancy or anytime during the baby's first birthday. There's no sort of cutoff point. And the messages range in topics from provide information around Medicaid and WAKE and alerts, etc. Here are a few of the providers that have donated the text messages. So any of the providers that you see here on this slide have informed us and have worked with us over the last 5 years to make sure that their members or their clients are not charged for the text messages that are received or sent. And when I say sent, I don't want you guys to walk away thinking that this is sort of a two-way service. We're not quite there yet. So in other words, moms cannot text back to us and say, my baby did not feed well last night. What should I do? Unfortunately, because this is a health initiative, we take that information very seriously, and we provide information to moms when they do contact us, whether it be via text message or email, and we let them know that they need to contact their medical provider because all the information that we provide is on a case-by-case basis. So once again, here's a quick breakdown on some of the things that we talk about. We have well baby visits, screening messages, prenatal care, oral health, but we also have several soft messages in between. And some of these soft messages are things that sometimes we want to hear as women specifically. I remember when I was pregnant, I, loved getting a message right after I had my baby telling me that it's okay for me to go out and hang out with my friends and even enjoy a cup of coffee and leave the baby alone with my husband, that was okay. But it really helped me and encouraged me. And these are some of the messages that we include to let moms that it's okay and let them know that, things that they should be looking out for, both for their well-being as well as the baby. So here's another slide that shows a little bit of how we layer the content. So we have a message that has a hyperlink or a mobile website that directs you to this page that we developed with March of Dimes. It provides very specific information, and there are additional tools like the video that you see at the end. That's a time-lapse video. It talks about why it is important to wait for 39 weeks. This content in the vast majority is also available in English and in Spanish. And so it's a great tool for moms to have, specifically for moms that you guys are probably going to be interacting with, which are a younger audience, that they are more interested in not just getting a text message, but being able to be more informed via video content, additional things that they can link to. So that's one wonderful thing that we have that I would definitely highlight that you guys, invite you guys to recommend during your next efforts in the next couple of weeks and beyond. We also have an appointment reminder service. I always joke around with our partners and I tell them, you can tell moms that they can use this service once they sign up for Text4baby to really promote anything from getting their hair done to getting their baby to their appointment. So it works very simply. They simply text the word remind, or in Spanish the word cita. The system will then ask them for an appointment time, and that information will then be saved in our system, and they can also include a very brief description. I included in here Dr. J, 10:30 a.m. It could be something like immunization with moms. So those are some of the information that we would like to include in your appointment reminders. And the way that it works is that you will get, or the mom will get, an appointment reminder text message 3 days before her appointment in the morning of. In some scenarios where you have appointments that you set for next week or the week after that, it might not be that difficult to remember. But when you have appointments in settings like weight or getting your health plan or follow up with your well baby visit, you might forget if you said it 3 months ago. So these are great tools that you can have, and I also encourage you to tell moms about this information. So I wanted to also highlight a few unique additional tools of the project that we have been working on with a couple of the agencies across the country. One of those is that we are taking Text4baby to not only provide information, but we're using it as a public utility for agencies. The very first example was Medicaid approached us, and they wanted to know really what our framework was, or what type of population we had in terms of their insurance status. So we came up with this very 3 questions, which is really a survey that we're providing via text messages, which asks, first of all, what is your insurance status? And that's what you can see on the pie chart. And then for those individuals that tell us that they are non-insured, we then send them a follow-up message saying, this is information that, or this is what Medicaid or WIC or CHIP would cover, including checkups and your delivery and dental visits, etc. You might qualify if your income is such. Call this phone number or visit this website. And then a week later, we go back and we ask that exact cohort if they, in fact, applied for Medicaid or CHIP. And we get a very high number of individuals who do. So not only are we providing real-time information via survey, text messages, but also we are connecting moms, and we can then share that information back with our partners. So we're able to tell Medicaid, the Centers for Medicare and Medicaid Services, which of our numbers, or an aggregate number of individuals who have actually applied for Medicaid and CHIP. So it's very cool to know that in a matter of hours, we can send out a national survey of responses that are really high in comparison with some of the things that traditionally has been done in public health or health delivery in general. And then I also wanted to tell you, of course, that we have launched a Text4baby app. So both the app and the text messaging components are free. You can go to the Apple Store or your Android store and download the app. It's another way of providing information. You can definitely scroll through any of the weeks during pregnancy once you signed up. The messages in the app are correlated to the text messages. So we do ask for your phone number so that we can then provide you the text message component as well. And it's a great way to set up your appointments and sort of keep track of things. And we also have incorporated fun things in there like polls where we ask moms, what do you think about, how much food you should be getting this week, and then we provide that information back to moms. So it's a way to, once again, provide information to moms. We do not sell products on our app. We do not promote or give coupons. So that's another cool thing about the app in the sense that there's not a lot of that commercial interest at stake, but there is just more real-time information for moms. So really quick with our audience, and as you guys might have hinted from my very early introduction, we're looking at the low-income African-American and Latina. We are looking at moms, of course, who are pregnant, who have babies under the age of 1, typically within the age range of 18 to 24 years, but there's no limitation in terms of the mom's age or whether it's a dad who signs up or an auntie or a grandfather, as I mentioned earlier. So we know, and you guys are probably more accustomed to seeing this, and that, the demographic that you guys are in, it's very common to send a text message, to communicate via internet, Facebook, etc., specifically within our communities, the Latino and the African American communities. So it just made very much sense to have these tools available within the communities. And we are, in fact, reaching individuals early in the pregnancy. So about 40% of those who enroll in Text4baby do so in the first 3 months of their pregnancy. And so that's key for us because it means that we're really providing information to moms early in their pregnancy, and we're connecting them to resources when they need it the most. And then we are reaching women in high poverty areas. So some of you might ask, well, how do we know this if we don't ask about income, or we don't ask some of the questions that can lead us to this? But because we do inquire about zip codes, we provide that information to our team, and they look at the zip codes where moms are enrolling compared to the census level data, and that's how we're able to provide and really yield a large number of enrollments in the zip codes with high levels of poverty across the board. So I wanted to just show you this slide. This slide really provides information on how we're changing behaviors through simple text messages and additional resources and reminders. Moms are telling us that we are improving their health knowledge, so they're more equipped to become better mothers, or they feel as such, and that's a great thing for us to be able to boast about. We're also improving appointment attendance, and they're also speaking to their doctors because of a message that they received. And that's the reason why it's so important for us to know that due date or the baby's birthday, because we kind of know what the schedule is like for those well baby appointments or those prenatal visits. And so we send some messages that would sort of be fresh in a mom's mind when they go to those visits, to talk to the providers about vaccines they need to get or symptoms that they're feeling. We actually had a great story last week that was sent to us by one of our partners. She had a mom in her community who unfortunately lost her baby, but her story was that Text4baby saved her life because she had received a text message about preeclampsia. Preeclampsia is when you have really high blood pressure and it affects you and it can affect the baby. And so was the case with this young lady, but she had gone to the doctor's office and they had checked her before she traveled, and she was fine. And what happened is when she traveled with her husband and family, she ended up having more and more symptoms that led her to believe that something was really going on. And that's when she received a Text4baby message telling that she was, she was feeling woozy, or her ankles were swollen, things that were specific to that she needed to contact her physician. So she did, and her physician was like, you need to go to the emergency room. So she went, and thank God that she did. it saved her life. Unfortunately, she was not able to save her baby's life. But this is an example of how, this is probably 1 in 1,000 of how we're really connecting moms to information in a time when they need it most. And many of us, and I would say almost 99% of us, receive a text message, and we may not respond to it automatically, but we do read it. So that's also one of the strengths that we have. It's a mobile health initiative that our messages are read instantaneously almost. So here's another schematic that shows you how we are approving or how we're providing information, increasing knowledge. And this is data that you can find on our website. I won't go into much detail on this, but I wanted to also highlight that this is data from external studies and evaluations. This is not all Text4baby information, so it's not biased actually. So I invite you to go to our website if you want more information. So I want to talk to you about Text4baby and how we're doing a lot of social media information and how we're connecting to moms. For us, it's been a great experience in the last couple of years with the support that we've had from many organizations. We've gone to a lot of blogging and community events. We've gone to a lot of conferences where social media is sort of the realm that we want to engage moms with. And we have been able to create a robust website as a result. We also have a pretty big Facebook presence. Our Facebook presence is more geared towards moms. So it's about educational and information. It's a way to communicate directly with moms. And we have been building that slowly and surely. We are also now on Instagram, so I want you guys to make sure you visit both of those sites. And what we learned is that, the information that we provide in terms of help and advice really is more powerful than providing games and celebrity information. I think we've tried a couple of things here and there, but that's not been a key priority for us. So I wanted to also share that we have a Twitter channel, and our Twitter channel is more for our partners. So this is a place where I think one of the platforms that we have where I would invite you guys as PP is to engage and talk about how you're promoting Text4baby versus the Facebook channel. Now, we've had support from different celebrities, Brandy included. But what I wanted to talk now was sort of what you guys have lined up for the next couple of weeks/months, which is rather to promote Text4baby in the many different events that you guys are going to be doing in your campuses, in your communities. And so I wanted to leave this up here because it's very important from what we have learned from our partners that not only do you tell moms about it, but somehow engage the moms when they come up to your table, to your booth, when they come to your sorority, fraternity events, when they come to your PP events, to really engage them in a conversation and ask them to pull out their cell phone and enroll. And I would actually invite each of you to enroll while we're here on this stage and sort of get a sense of how quick it is to do so. You can also, if you have the capability of setting up a laptop, you can also do that. You just go to text4baby.org, and you can have moms complete the form there, and they will enroll. It takes them 30 seconds to do so. There are other things that I wanted to highlight in terms of how you guys should encourage other organizations in campus to share the information around the service. I included here a couple of pictures. There's one on the top right where there was actually like a little flash mob dance that moms put together in Nevada around Text4baby. So if you guys are creative and you guys want to go out there and do something like this to bring attention to Text4baby, I would invite you to do so. We also recognize how important it is in your community, specifically perhaps to engage churches, youth-based and civic-based organizations. We have materials such as fact sheets and things that I can then provide to you as a follow-up, or you can just go down to our website and obtain that information if you want to engage them in promoting the service. So I wanted to just leave you, of course, with the information that also Teddy mentioned. in that there are free materials, which I believe they're about to send you or they have sent you in your packets for the promotion during the month. These are materials that are beautifully done and that you can provide to a mom or take to a church or take to one of your events or display your tables during the month or in moving forward. And you can also order these from our website. I know that Teddy mentioned that there are materials that they will facilitate for you moving down the line as well, so you guys can figure out what the best workflow for them may be, so that you have the materials accessible for you and within your disposition. So I think that's all that I wanted to leave you with today. I guess now we can open the questions for, or the floor rather, for any questions or comments that we might have from the attendees.
Sure, Louisa. We only have a couple of questions right now. Can you please provide the Text4baby website?
Yes, of course. So it's Text4baby, and it's the number 4.org.
Okay. And yes, the PowerPoint is available. Louisa has shared the PowerPoint. So if you're interested in receiving it, just email me with your request at towusu@minorityhealth.hhs.gov. And that's all we have for today, unless, Louisa, is there something else you wanted to address?
No, I mean, I would just say that you guys are, a phenomenal force. You may not realize how strong an impact you might have on a young mom, given the fact that you are students and the fact that sometimes you guys can relate more to some of the moms in the community than perhaps their WIC nurse or their provider down at the Medicaid office. So I invite you guys to really think about how to incorporate the information during the efforts that you guys are doing this month, and then of course moving forward, because Text4baby, we don't necessarily, just consider our work to be month in, month out, but it's very specific to what we want to do, which is educate and connect moms to services. So try out the service, download the app, and then spread the word. And thank you for your time and for participating this afternoon.
And I just have 2 announcements to make. To the students, it's really important that you all take pictures and document your events and different things like that, because I'm sure Louisa can agree. The bosses, our bosses, like to see evidence that these interventions do work, that people turn out for these things, that, the posters and info cards and fact sheets do make a difference in the community, and people take heed to those things. And lastly, I would just like to let everybody know that there is a second webinar this month. It will take place April 30th. We are partnering with the Administration for Children and Families. They will present on identifying what relationships are, healthy relationships, domestic violence, how to approach someone you feel is a victim of domestic violence, and also provide you all with resources on the topic. So other than that, I would like to thank Louisa again for her time, and Text4baby for partnering with the Office of Minority Health and donating the posters and fact sheets and other information they've donated. So thank you, Louisa, and thank you all for joining us. And this webinar, again, will be archived on our YouTube site. Just go to the Office of Minority Health YouTube channel, and you should see all of our PPE webinars on the channel. So again, thank you all for joining, and thank you, Louisa.
Thank you. My pleasure.